Good evening and welcome to Headache School. Tonight is August 9th of 2022. The original title was going to be discussing sleep and headache, but we had a lovely lecture in May on that. And so I wanted to cover something that what I would say isn't really sexy, but is very important to the overarching picture of headache and management. And the reason I wanted to talk about lifestyle and headache is because it's absolutely what's in every individual's control. So as we look at the things when we talk about lifestyle, all of the above, we talk about nutrition, hydration, sleep, exercise, body work, mindfulness, all the things that really do matter. Sometimes I think it's really hard for us to engage both as patients and providers, sometimes the big picture of what this looks like. So when we're thinking about why talk about the elements of lifestyle, as I mentioned, the part of patients who have migraine really need routine. And that's, again, like I said, it's not super exciting. It's a little bit boring, in fact, but it's what makes the most sense to a migraine brain that is otherwise incredibly hypervigilant and excitable. It also, again, puts you in the driver's seat. And I think, we often as clinicians talk to our patients about the realistic expectation of medications, whether it's acute treatment or prevention, but we rarely give the same credence and balance to lifestyle. And the other part about it is lifestyle is hard. And I'll be the first to admit that as a clinician, we try to talk through things that patients have control over. But often I feel like patients leave a clinic visit that they may feel more overwhelmed with the game plan, medications, prevention, rescue. And really, this is such a key component that if we don't talk about it somewhere, hopefully this is a place that you can go to. My name, I didn't introduce myself. I'm Susan Baggaley. I'm a nurse practitioner. I've been at the headache clinic for about 30 years, and I really enjoy seeing patients, seeing the lifestyle changes patients make, having that awareness, and also working in partnership. So as we talk about thinking outside the medication box, the first area I like to think about is nutrition. And one, because this is really our fuel to our day and to our brain. And how do we get from point A to point B? So if we think about the diet and the lifestyle of the American existence currently, it's a lot of fast foods. We've been in a pandemic. We've used takeout for a lot of different reasons. And I think really when you're looking at what do I have to choose from and what makes the most sense, it's really the preparation of having good, healthy food in the house, but also things that have good energy and nutrient dense opportunity. And secondly, when we're thinking about food as fuel and not as a reward, I think it changes the paradigm of how we look at food, both from a migraine standpoint. We've often talked about using an anti-inflammatory diet or a little bit more keto-esque, if you will, diet, because those quick carbs really create a crash and a burn experience. And so you get a high fast energy, but really the impact on where that glucose is burning in the brain can be a quick trigger to migraine. So we know if you're having some protein at least every few hours, whether it's a handful of nuts, hard-boiled eggs, if you're looking at something like beef jerky, other ways to have protein, there's a lot of protein bars that are not necessarily high in sugar. Or if you have a specific diet, if you're vegan, you're looking for other ways to keep that protein count up. There are many things that are available to the general population. And then we talk about superfoods, and that comes along with that anti-inflammatory mentality, is thinking about berries, thinking about things that are the color spectrum. So just like that slide showed with that rainbow of food colors, you want to try and spread that out throughout your day. It's a way to get multiple resources of energy and vitamins, and not necessarily having to think about eating the same thing every day. So I mentioned that the migraine brain likes to be boring, but I think the nutrition part of a migraine brain needs a little bit of variety. I'm not really going to talk about supplements tonight. We've had Dr. Erica Marini, our pharmacist, cover this in the past, but also if you're really eating a fairly well-balanced diet, it's rare that you need too much for supplementation. The two ones that I would touch on would be both vitamin D. Many people have had their vitamin D level checked. In neurology world itself, we tend to ask patients to stay closer to the 40 to 50 range on their lab values, where normal is 30 to 80, because we know that sometimes low vitamin D can be a little bit of a trigger in the autoimmune world and triggering that switch. Also, magnesium is often talked about in the world of headache management. And part of that is because it does help reset some of those irritable electrical transmitters, can help support sleep as well. But again, I think you want to be very thoughtful with supplements, just as you would be with any medication, because sometimes things can make headaches worse. So that's kind of where I'm going to leave it. But I think always being cautious about anything you add to your plan. If you're going to do it, only do one at a time. Space it out between 2 to 3 weeks before adding in a supplement, so that you don't know which causes what problem. Thank you. Then on hydration. So this is a big one. If we're thinking about your irritable blood vessels or that vascular system in migraine, and that's not the only system that impacts migraine. We know it has neurochemical electrolyte balance and other things, but you want to not have yourself so dehydrated that you don't have any volume to maintain that sustainability. And oftentimes, I think there's a mixed message in drink more water. We always want patients to have a minimum of 8 glasses of water a day. It's a good amount to make sure you're getting enough cleansing, but also, we talk about if, quite frankly, you notice your urine is pretty clear, you're probably getting enough hydration. If it's not, you're likely not. But the other part of this is that if you just only drink water, sometimes that can actually dilute your natural salts and electrolytes, and you may get more symptomatic. And that's why we talk about using sometimes supplement drinks or tablets. A drink like V8 can be helpful because it provides some potassium and sodium. So you want to mix this up a bit, just like you would with your diet and exercise. The other thing to think about is fruits and vegetables are often high in water content. Melons, for example, can be really another additional source that you're eating, as well as getting the fluid replacement that you want. Sleep. As I mentioned at the beginning of this lecture, on the May 18th series, Dr. Singh spoke in depth about sleep, but I just want to talk about it from a perspective of the entire experience of lifestyle options. So routine sleep provides that restoration of the brain or reset. If we can't really get to sleep and stay asleep for reset, it's very difficult to really have that foundation for a wakefulness in the daytime. But oftentimes patients with chronic migraine seem to be incredibly fatigued, and then it's time for bed, and the next thing we know, they can't turn their brain off. It's like they've started writing the list of the things they didn't do today, they need to get done tomorrow. And so creating that routine in light of this. So what we talk about in sleep hygiene, getting to bed at the same time, trying to get up at the same time. And even if you can't quite get your brain in that framework, it's the way you start creating the habit. So the one element that I run into a lot when I see patients is the weekend letdown. And that ends up being that, gosh, it's wonderful. I get to sleep in today. This is going to be great. And the next thing you know, you sleep in and you have a terrible headache, or you go on vacation and you crash and burn. And then you're like, oh my gosh, it's been 2 days and I felt nothing but a bad headache. So always trying to keep a close proxemics to a regular routine is really important. And along with that routine is what the environment looks like as far as the bedroom. So we talk about keeping it as close to dark as possible. Sometimes even blackout curtains can be helpful. But really more importantly is probably the blue light that are emitted from both your clocks, your phone, your television. I think the screen time element, if you're sleeping with your phone next to your bedside, the difficult thing is it can go off at night, even if you put it on a do not disturb mode. So if you can at all costs keep your phone not at the bedside and maybe leave it in the kitchen. I understand with parents who have kids that are out at night, you don't want to miss an important phone call, but other ways to try and keep your brain from being overactivated, I think is super important. The other option is also, or other issue rather, is really trying to focus on sleep consistently for about 7 to 8 hours nightly. A few people can get away, I found, with fewer hours of sleep, but in order to really get to that depth of sleep, restorative sleep, and then feeling refreshed is likely about that amount of time. We come into a really big set of issues when we see patients who are shift workers. And I want to be mindful of this because it's one thing to say, go to sleep at the same time, get up at the same time. But gosh, when you're working 3 12s and then you flip from a day shift to a night shift, there's a lot of disruption. There's a lot of inconvenience to the migraine brain, I would say, as far as trying to find the status quo. Oftentimes, if it's possible, recommend to patients to try and stay pretty close to a similar routine, even though that doesn't make it necessarily realistic. But be mindful of time with your family, be mindful of time with how this works. And if necessary, sometimes we do ask for work accommodations for people to avoid having those late midnight shifts, because it really does disrupt sleep and increases migraine. Exercise. What do we say about exercise? I think two things. One, find a way to be successful, and two, create a new habit if you're not doing it already. And trying to find a way to be successful, when I hear patients tell me that it causes they're in too much pain to exercise, it makes their headaches worse, or they're too tired to exercise. And all of these are incredibly valid complaints, except the fact that we know exercise actually improves pain control. It improves anxiety, depression. And so this is not about you go from nothing to 4 hours a day, but actually finding a way to create a new habit and create a baseline. So small increments daily on a scheduled basis. I would rather have a patient tell me they can do 2 to 4 minutes every hour or every other hour while they're awake, that they just get up from their chair or the couch or able to leave their work environment and walk the building for a few minutes and then come back and check the box and build upon that, as opposed to I have 30 minutes for lunch, I eat really fast, and then I go for a 20-minute walk and then I feel sick. So I think trying to keep an idea behind this, that maybe for the first week, you do 2 minutes every even hour during waking hours. And then the next week you add in the odd hours. And as simple as this sounds, if you think about it, if you're doing 2 or 3 minutes 8 times a day, that's 25 minutes, pretty close. And then all of a sudden you're like, that just added up quickly, and you can start building upon that, as opposed to looking for a chunk of time that really our lifestyles these days don't often lend themselves to. But it also gives you time away from your activities of work or other things that clears your head for those few minutes, taking some deep breaths, giving yourself some space, and be thoughtful about what your day looks like. And that third bullet point about pacing is really important, because I do find that all of a sudden someone tells me, well, I felt so great, I decided to climb Mount Olympus. And what happens on that day is that you might have had that incredible burst of energy for a 7-mile hike, but then for the next 3 weeks, you can't do anything. And so again, not to have that extreme of an example, but I do think it demonstrates the fact that you're better off to build a baseline and continue to create that pathway for your brain, as opposed to, I don't feel well, I feel well, I don't feel well. And when you do that, pretty soon it's just like your hydration and everything else. It just starts to meld together so that you can then take the next step to get more minutes in per day. I like to talk about body work because I think this is important when you think of other comorbid pains that exist in headache. So whether patients have fibromyalgia, they have other musculoskeletal complaints, they might have spots. They may have all kinds of areas that trigger other pain syndromes. Is to think about ways that you can do things without having to cost yourself a lot of money. Even massage can be helpful, but it's expensive. It does take time out of your schedule. It is a treat, but sometimes when you have a massage, it can increase some of the pain because of how the therapist may be working certain areas and neglect other parts that may need work. So I'd like to provide these two websites that can be very helpful. They're free and show you actually sort of the interaction of how to release trigger points. And then there's actually a workbook that can also show you how to do some trigger point release that you may be surprised actually impact the way your muscles respond and relax. Anytime you're doing any work, though, with trigger point release or a Theracane, for instance, you want to make sure you're still hydrating well and paying attention to what the body's messaging is. A Theracane is a simple tool that's a very rigid cane, basically, that I recommend because it's, well, and it doesn't have to be that brand name, but something like this, because it can be useful. You can have it by your couch, you can have it at your workplace, you can buy a couple, have them handy as long as your workmates don't take them away from you. But what's nice about it is you can find that area, you can ice it with like a gel pack. That's because anesthesia from ice is really excellent. And then for about 5 minutes, and then find those spots with the trigger cane, with the Theracane, and really let that muscle that's in tight spasm almost feel like it's filtering underneath it, like a little feather or a quiver, until it releases. And so sometimes you have to hold that spot 60 to 90 seconds to actually get some of that trigger point to release in those tight muscles in your trapezius or in your scapula, other areas. And then after you've done that work for a couple of minutes or so and you move to a new spot, you can always take a hot, wet washcloth followed by with a hot rice bag from the microwave, and then really find a way to elongate those muscles. Give yourself a good stretch. And with that, then kind of move down the spine or other areas. But it only takes a few minutes and you can start to really feel those areas. And what I think, again, is key to using a tool such as this or these other workbooks is that it really puts you in the driver's seat of how much pressure, what your pain tolerance is, and you're not having somebody else necessarily do something to you, that for the most part, you can control those areas. I would be remiss if we didn't talk about what stress management means in the load of our lifestyle. So Don Buse, who's an expert psychologist and pain and headache expert, offers a free website to shows videos on how to teach relaxation and visualization. So this is an excellent, again, free website. UCLA also has a website on mindfulness with a free guided meditation. And so these are available to the public. It's public domain. And anytime we can find ways that work for us to get to a different place, I think can be helpful. There are some devices that people use, whether it's a TENS unit, a Cephally device, or Nervivio, other things that we use acutely or for headache treatment. But I always like to talk about things not associated with the acute intervention, but more as a daily lifestyle mantra to find your way through some of these relaxation techniques. And then just to wrap up with my last point, it would be about caffeine. And I think the big picture is sometimes there's mixed messaging in caffeine, and sometimes there's both positive and negative within that. So caffeine affects the adenosine receptors, which actually create a vasoconstriction in the physiology of the vascular system. So what happens if you have too much caffeine? Basically, your receptors stop responding because they just think, oh, I'm going to need more to get that same constriction. And then you get into that element where we talk about caffeine overuse. Also, you have to think about medications that you might be taking that also have caffeine that would count towards the caffeine utilization. Simple things that are over the counter, like Excedrin or Costco brand Excedrin, Tylenol, aspirin, caffeine combination. Butalbital containing medications also tend to have caffeine in them. So you have to be careful, but you also have to be really careful about quantity of caffeine. And so the one thing we know as we talk about that double-edged sword is that caffeine can sometimes help with migraine rescue. This is true, but that's more for a person who probably doesn't use caffeine on a regular basis and then finds it to be useful to enhance the response of an analgesic. I try to aim with my patients for about 12 up to 20 ounces per day, because the reality that I mostly hear from somebody is, but Susan, I buy one of those drinks with a lot of ice, so I'm really only getting about 12 ounces, even though it says it's 32 on the bottle or on the glass. So at the end of the day, if you're drinking something like the 128 ounce, like gigantic mug, think about ways to make it realistic for you to get down to about 12 or 20 ounces. And the easiest way, I kind of use the rule of fours, and that's 4 ounces less every 4 days, but up to a week at a time. Because if you really are habituated, I have patients who come in with their 2-liter bottle of Diet Pepsi and tell me I don't have caffeine rebound. I just drink it every day because I like the taste. I would never want them to stop cold turkey. That would make them very, very ill and create a whole different set of problems as well. But I do think that caffeine has its benefits as well as its risks. And I would probably suggest being thoughtful about one way or another, if it's diet, if it's not diet. I don't have a preference. I think we talk about some of the nutrition elements that we have to be careful about with some of the supplements for the diet sodas or some of the sugar-free foods that are out there. But overall, keeping in mind that when you're trying to avoid caffeine to a point, it's been said in the past that for every 12 ounces of caffeine loaded soda or drinks you have to drink about 1.5 times that in water to equate back to a 0 level of balance, because it's actually like a diuretic for you. And so you want to be able to make sure you're not underrepresented in your fluid intake for the day either. Okay, so that is really just the quick story of the evening today about lifestyle management and options and treatment of headache.